Hi, everybody. This is a little presentation I've put together on the facts on vax. My name's Dr. Kate Mills. I am not a medical doctor, I'm a physical therapist. Um, I treat patients who are, just because my area of specialty, my patients are more elderly in general, and they have a lot of those we call concomitant comorbidities, basically several different health conditions that predispose them to getting more sick or being hospitalized, with even catching flu, let alone measles or COVID or things like that. I just kind of reached a breaking point, guys. Where the more I spent so much of my time during COVID having to do like extra research for my patients' family members, for my coworkers, to just try to make sure they understood what was actually going on and what was politics and what was science. That one was trickier because science was changing. It was a novel coronavirus. That is the definition of novel. Recommendations are supposed to change as we know more. But measles, no, that's a pretty well understood one. So let's take it from there. With our Health and Human Services Secretary even currently giving some misinformation about this outbreak in Texas, about why people are being hospitalized. I think he said mostly for quarantine purposes. That's not the case. The kids largely that are hospitalized, it's mostly for measles related pneumonia, which is not too uncommon. I'll go over some specific measles. Basically, this presentation specifically is focused on measles. Because that's what's sort of going on right now. But there's just many common themes that go along with the just the principles of vaccinations in general. Let's take a look at some of the details of this West Texas measles outbreak. It started in Gaines County, Texas in mid-January with 2 cases of unvaccinated children. By mid-February, it had spread to 9 counties in total, making it the largest outbreak in Texas in more than 30 years. And then by early March, there were 223 cases, with 29 of those cases hospitalized. It comes out to about 13% hospitalization. And that is not insignificant for those people who want to say measles is really not that dangerous anymore, because it doesn't cause that many deaths. Here are 13% of cases in less than a 2-month period of time. And most of these cases are children that are in the hospital. And no, Mr. Secretary, not one of them was hospitalized just to be quarantined. They were all there for measles related complications. Pneumonia is a huge one, as stated, but the regular sort of complications that come with kids getting sick with a major serious virus, fevers that are not able to be controlled. Just those are things that need to be considered when people just want to take a look at deaths and determine that a virus isn't so bad to just go ahead and run through a community. But speaking of deaths, in this relatively small population, small sample size, there has now already been 2 deaths of children, an 8-year-old and the 6-year-old, both documented as unvaccinated with no reported health issues prior to contracting measles, making them the first measles deaths in the United States since 2015. Not exactly making America healthy again. Currently, there is 541 cases being reported across 3 states now. And as is common in these areas, and specifically with measles, because how rapidly it spreads, there is likely a significant undercount due to these same communities also that are under-vaxxed are also under-tested. They're not going to health clinics to seek testing, treatment, vaccinations. And the updated hospitalizations are 57 at this point. And to give you an idea, last year's total measles cases was at 285, which I think we've already surpassed that. So 27 out of 32 cases in New Mexico were unvaccinated, and the vaccinated status was unclear for 5 of those cases. There was also a death of an unvaccinated adult who tested positive for measles, still being investigated since they did not seek out medical care. So they just weren't exactly sure all the details. Since the 1980s, the sort of infectious disease community, scientific and medical community, has placed that 95% number as the level of vaccination rate in the general population that is recommended to achieve herd immunity. And Gaines County, where this whole outbreak originated, had a less than 82% vaccination rate for measles in their kindergartners. So here, once again, is a good example of science kind of getting it right. Like from many, many around the world studies, we know that once you're at that 95% rate, the chances of anybody getting infected with whatever disease we're talking about is very low. And even if they do get infected, they're not going to be able to spread it because the community as a whole is so well protected. So, although there is a wealth of material to choose from, here I'm going to be focusing on some of our HHS Secretary's greatest and most dangerous hits as far as misinformation on vaccines goes. So, for starters, he has said we lack comprehensive safety studies on nearly all vaccines. I'll give some data on that. Then, if you are healthy, it's almost impossible for you to be killed by an infectious disease in modern times. I have a few, several hundreds, thousands of people, marathon runners, teenagers, young adults that died of COVID, that their families would take issue with that one. Referred to the measles outbreak in American Samoa as a natural experiment, going on to imply that natural infection of measles in that country could be beneficial to the population to build up their natural immunity. Another thing that we've heard by Dr. Scott Atlas during the COVID pandemic, really wanting to promote the benefits of natural herd immunity as opposed to getting people vaccinated and building herd immunity that way. And this presupposes that all those people that you're knowingly infected, and in the case of measles, children largely, that they're going to be fine. And in COVID-19, you're talking about elderly, that, when you're going out there and saying, let's just go for, good old natural herd immunity, let people get infected, let the virus run unchecked through our population, you're basically saying that, we're going to be sacrificing some kids in the case of measles, some elderly in the case of COVID-19, but we got to get to the other side. So you guys can decide if that's a health, quote unquote, professional that you want to be in charge of anything, let alone your children or your parents' safety and medical decisions. First myth that's being spread by what's supposed to be, I guess, like our top cop of our healthcare system in this country is that we lack comprehensive safety studies on nearly all vaccines. So here I'm just trying to give some actual real talk backed up by cold hard numbers. And although it's virtually impossible for me to keep myself from sounding or having a tinge of aggravation, condescension, frustration, my voice, what I'm actually presenting on the slides are facts. I provide sources so you can do with them what you would like. Just as an interesting fact, when I went to research um, the FDA website to get some of the actual numbers on vaccine safety studies and provide a direct source. This is what is up now at this point. This is also what was up when I went to research the same thing, CDC and World Health Organization all did same studies and have published results. And this is what it says now, because we're not allowed to know that information in one of the most transparent administrations, is what I keep hearing from Mr. Musk. Luckily, I was able to utilize the Wayback Machine, which I consider a national treasure at this point. If you guys haven't heard of it, you should check it out and you should definitely donate. It basically has archived sites that have been taken down so we can still access them. And that is how I got some of this data. But as far as safety and efficacy claims that are being made by vaccines not being well tested and controlled, randomized, double blinded studies, yeah, all that's completely false. So you can look it up. Vaccines typically undergo safety testing for 10 to 15 years before they are approved for public use. I won't go into all the details about the potential problems with double blinded studies with vaccines, but there have been double blinded studies. And control randomized, yes, definitely. The process to get approval is extensive. So, the vaccines are actually more highly tested and regulated than most over the counter drugs and supplements that most of us really don't think twice before using. So, all that fear mongering is just that and completely unfounded. Moving on to myth number 2, that the number of scheduled vaccines dramatically increased after 1986 when vaccine companies became protected from lawsuits. Here is one of the claims I just kept coming across. This in social media. This is a post that some form or another you have probably seen, that people are saying, because our Health and Human Service Secretary has said this in many interviews. Back in the 60s, there was 28 doses of vaccines, and that apparently now, supposedly, as per him, we have 72 doses of vaccines that we're supposed to be taking. And the more important part of this chart is what they're trying to say happened in 1986. They're trying to say that there was this big jump from this 24 dose 1983, and then in 2019 apparently somebody is telling them that they have to take 72 doses of vaccines. And the anti-vaxxers are answering that question, what happened in 1986 with this Reagan legislation that was passed in order to basically, same thing that they keep talking about with guns today, but his effort apparently was to pass legislation that diverted vaccine injury claims to a newly established program, the one that's still around today. So it wasn't that you couldn't sue the big pharma vaccine companies. It was that they realized the whole supply and demand thing. If vaccine companies could be sued for every parent that said something that happened after a vaccination was due to the vaccination, these vaccine companies were not willing to put out to mass produce vaccines, and it was having an effect on the overall public health. So Reagan stopped that by this legislation. That is what they're saying brought about this huge uptick in vaccinations. That once the vaccine companies realized that they couldn't be sued for causing harm to people, that they naturally just the government just started mandating all these useless vaccines because nobody could get sued. So that's the claim. And here we are. Here are some facts. 1948 vaccine schedule. This is how many were given. You can see between smallpox, again, this actually just goes up to 6 years, where the current vaccine schedule goes to 18. But we have smallpox, several doses for smallpox, pertussis, the DPT, tuberculosis. Yeah, there was a good number of them. This was not a, back in the day when we only got 6 shots situation. That's 1948. So here's 1983. This was right before that 1986 legislation we were just talking about, that RFK and all the anti-vax followers say shows malice, basically, or unethical practices. So this 1983 schedule called for 11 doses of 4 vaccines that protected kids against 7 different diseases. And this one, this one goes up to 16 years. So we should be expecting to see a ginormous jump in the 1989 schedule because of all the unethical practices, right? And now all these vaccine companies are protected by this Reagan era legislation. So they should be really hopping out there, and government should be mandating all these extra vaccines. It just doesn't appear to be the case. This one has 12 doses of 5 vaccines that protected kids against 8 vaccine preventable diseases. These nasty pharma companies, this is what they are doing. They increased it by one actual dose more from the 11 that we were taking in 1983, did I say? And 1 vaccine more. So there goes that, just to make sure everybody's on the same page. 1983 was before the Reagan legislation. Vax scheduled includes 11 doses of 4 different vaccines that protected against 7 diseases. 1989, after the legislation passed, the vax schedule included 12 doses of 5 vaccines protecting against 8 diseases. So our vax schedule today calls for 15 total vaccines, and actual doses vary based on manufacturers, since some have been able to combine several into one shot. So as I was actually trying to count up how many doses, there is so much variability now, because some can be given and missed. Some can be given, if you're a little behind, they can combine 3 different vaccines in one dose. 30 years later, we went from 5 vaccines to 15 vaccines. and still nowhere near 76 doses, which is what that original post, I believe, said 76 doses. So there was nothing factual, to be clear, about that original post of that sloppy cut and pasted sort of chart of all the different vaccine schedules and how it is supposed to make absolutely clear that we're being, sheeple or being taken advantage of by the government and big pharma in bed together, pushing all this. Literally none of it is true. Nobody's getting 76 doses of vaccinations. And there was no jump in mandated vaccinations after that legislation was passed. So you can think whatever you want to think about pharma, and God knows, again, I'm a medical professional. Like, I get it. There, two things can be true at once, I think, is what the big picture is. There can be unethical practices in pharma and definitely government. Vaccines, it's not one of them. We have lots of proof of what vaccines do and how much they've been studied and tested.